If anybody was at Texas Life Science Forum yesterday, you'll see this same set of individuals had a great panel discussing technology transfer out of the institutions in which they work. We're going to avoid that topic today. We're really going to focus on just two specific topics. And ahead of time, I told them that I might, and I will, put them in the somewhat awkward position of sometimes taking kind of the con position for something that you would reasonably think that they were in the kind of a pro or a for position. So a little bit of a debate format. I recognize that based on my initial feedback, they're like, ooh, that could be tough. And I needed to put a disclaimer out there. So I'll start with that. I said to ChatGPT, I need a disclaimer for this group of 4 individuals. And here's what ChatGPT wrote for me. The positions our panelists take today are assigned for the benefit of the format. They do not necessarily reflect their personal beliefs or the official positions of their institutions. Our goal is to illuminate all of you, blah, blah, blah. ChatGPT is a lawyer. So I said that. So you're all free to say whatever you want now. Just feel free. So Joe, Vineet, Emily, and Bruce, I'm going to not do deep introductions, just to say Baylor College of Medicine, UTMB, MD Anderson, UT Health. We're just going to jump right into it. So I really want to start with the NIH and the sort of eye-opening moment earlier this year when they talked about the impact of cutting, or when we started to talk about the impact of cutting indirect costs to each of your institutions. And so for those of you who know, actually, you know what, let me do this. Let me put Joe, what's an indirect cost?
Indirect costs are the charges that are applied or we recover when we apply for grants to pay for the things that run a scientific endeavor. So overhead, animal facilities, dishwashing, regulatory, all those types of things, procurement, all that gets covered by indirect costs because you can't make those charges directly on a grant. Put those charges directly.
Emily, how does an institution figure out their indirect cost rate? And is it the same at all institutions?
Oh, that is a great question. Our finance team would figure that out and negotiates that every year with the government. No, it is not the same across all institutions. We have different rates for clinical and preclinical, and that varies across the board and gets negotiated, I believe, annually. But yeah.
Fair enough. Vineet, why are indirect costs a problem?
Yeah, okay.
Why is the government targeting indirect costs? What's the issue?
I think to be fair,
remember, I read the disclaimer already. You're good. You can say whatever.
Okay. It's really a challenge of fairness and transparency for the taxpayers. That because indirect costs lumps so many different things that we do at a university, like Joe said, they want to know actually, are you really spending money on that, or are you using these dollars for something else? And I think that transparency is important, and I think we are moving towards it.
Very good. Very political. Well done.
Wow, well played.
Bruce, if you could rewrite the legislation around indirect costs, what are some of your thoughts about creating fairness and transparency across the different institutions?
Yeah, I think one thing it would be to designate where funds can be spent and even put caps on certain things. You know, an indirect cost on something, on software development is the infrastructure that's very minimal. Indirect cost on something that's got a toxic material, you've got to have environmental safety and issues like that. The other thing I think that we're going to find out maybe is that indirect costs are high. This government doesn't like paying them, but it very much subsidizes the institution. So when the institution is working, speaking of innovation, with companies, they don't want to pay the same indirect cost. Oftentimes they don't need to because the institution is getting a decent return from the federal funds. So the federal government is actually, through indirect costs, is very much subsidizing innovation because startup companies don't have the funds. They can't pay a 50, 60% indirect cost. So I don't think that's being acknowledged at the government when they look at cutting indirect costs. It's going to have a ripple effect in this arena, that's going to be tremendous.
So along with indirect costs, we're going to stay just a little bit around, we'll turn that into incentives in an institution. And Joe and I have talked about this in the past, so I'm going to cue you up again. When we think about sort of the NIH and the incentive structure it's created since post-World War II, they were funding research at institutions. It is about, things like publications and getting your next grant, and those things are tied to tenure. And so when you think about the academic faculty and what their incentives are, it's sort of grown up as what's the right word? Not institution. As a part of the academic landscape to think about, what do I have to do to get my next grant, to get my next paper, to get my next promotion and tenure. So Joe, what are your thoughts around if indirect costs get modified a little bit and overall NIH funding for things that are, we would say overhead costs, is there a way to use that as a tool to change incentives at Baylor College of Medicine?
That's a good question. So I would say, so first of all, if indirect costs are modified, just say like Baylor College of Medicine, the indirect cost rate is 60%. So when you write a grant for $1 million, you're actually asking for 1.6 million. It's not, there's a little confusion too, that if somebody writes a grant for $1 million, 600,000 is not going to indirect costs, it's on top of that. And then also, just to set up the answer to this question.
Please.
So the true indirect cost that we pay, that 60% number, is, as Emily mentioned, is a negotiated rate with the NIH. So it's negotiated, so you had to come down from what your true indirect cost was calculated by your CFO and your business people and so forth. So at Baylor, it's about 80%. And then the actual recovery is closer to 27%. And so the thing is that foundations don't like to pay full indirect costs, companies don't like to pay full indirect costs. And so we have that in there, and think that the indirect cost rate, say, gets capped at 35% when we're looking for 60%. That's about an $80 million hit to the Baylor budget. And so with that, the ability to start up a new center or to fund a core that's going to be doing the next, so we have a metabolomics, we have your favorite omics cores that's sort of help drive the next round of innovation. Those things start to go away. And so to incentivize, so to get back to your question in terms of how do you incentivize, what changes could be made to incentivization, we incentivize commercialization. So I don't know if you were going there with that. I know we were talking
That's exactly where I was going.
All right, so that's good. All right. So for promotion, so we have a faculty promotions committee. Publish or perish, write grants, get 2 R01s. That's how you get tenure, which means it's a whole other panel. But from an incentive perspective, if you're involved in getting patents, if you're involved in commercialization, we now make that as part of the criteria to sort of help level up if maybe your educational mission isn't as strong, or if your research, or you're missing a couple papers, maybe from where you need to be for your promotion. If you're involved in commercialization, then that is reflected in your promotional criteria.
Yeah, Vineet, UTMB is really focused on commercialization as a way, I think, obviously to get the research out and to help humanity as a first and foremost, but also potentially as a way to drive revenue back to the institution. So can you talk to your faculty about using structural changes like indirect costs as a way to focus them more on commercialization?
Good thought. I hadn't thought of that.
See, I'm giving you everything you need.
Thank you. I think it makes sense, right? And I think it makes sense for the faculty, it makes sense for the system, and it makes sense for the patients, because if you can accelerate commercialization of some of those technologies, it will make a difference at the end. So, I mean, I agree with it. I agree with the thought.
Right. Emily, we're going to switch to you. MD Anderson's an incredible powerhouse when it comes to running clinical trials in oncology. We've seen over the last 5 years ago, I would not be up here talking to you about the efficiency of running clinical studies in China and the ability for products to come out of Chinese biotech from a commercialization perspective. How's MD Anderson thinking about, I was with a VC last night And he was talking about starting a biotech and having all the work done in China. Just from a time and cost perspective, and we're talking about, he's making up the math, I'm sure, but, a $20 million clinical program dropped to $4 million. So MD Anderson think about, or you specifically, think about the rise of the opportunities in Asia to be more efficient, both cost and timeline.
We were just talking about it earlier.
Yeah, we were just talking about it and sort of the challenges, obviously, we face with the current climate and what we're able to do and what we're not. I mean, I think it's very evident that you can do something at a fraction of the price. Trying to figure out where we can plug in, how we can be prepared for potentially the future, how we can differentiate from what can be offered there versus here. I think there is certainly a place and a time for what can be done there. And then as you're looking at expanding into a U.S. population, that's where I think we can really help and step in. Obviously, the costs are different, but I think that's data that's going to be needed, and obviously we talk a lot about that. So it's hard to compete with that, but I think it's just we have a place, when you're trying to break into the U.S. market, and that's where we are right now. I think we just have some limitations that prevent us from being able to partner as much.
Well, sharpens the knife, right? So MD Anderson and the other institutions that run trials here will have to just rethink about, how we can do it faster, more efficiently, and cheaper. Bruce, to you, I'm going to end with you. As you think about, you mentioned yesterday in the panel about the large IP portfolio that you hold across the institutions at UT Health, and now this sort of like opportunity for things to show up seemingly overnight in the China biotech space. What do you think about your IP portfolio and not only protecting it, but also trying to understand what competition in China will look like? How's your institution starting to come to grips with that?
I'm an interesting person to ask that.
Okay.
I've been to China a number of times. We do file Chinese patents routinely when we're going to go international, and most other institutions won't do that. We've learned a lot about the Chinese patent world, that they have different types of patents, and we've got an example right now where they filed a patent to get in front of us, and we've maneuvered around them, and now we're working together. We're not afraid to work with Chinese companies. Obviously, there's a tremendous amount of scrutiny and a tremendous amount of oversight that needs to take place. Typically, it's more of a lower technologies. In other words, the devices, the disposables. It's not going to be a top secret type thing like that. The attitude is we can't enforce our patents in a lot of foreign countries, not just China. So we try to structure a deal that would accommodate the fact that we can't audit them, we can't go back, we can't sue them, we can't. If they're supposed to reimburse us for patent costs and they don't, then we make them put a retainer on board with the law firm.
Yep.
So we've structured ourselves to deal with China. Things have slowed down, obviously, because of the political climate. But my prediction is a few years from now, we'll be back where we were a few years back. And it's still the largest economy and the largest patient population in the world.
Yep.
And at the end of the day, we have a simple device right now that we're talking to a Chinese company. At the end of the day, they're going to save lives. They can produce it cheaper than anybody else in the world, so they will produce it for the European market. They'll produce it probably for the American market. So we try to keep that, at least I do, try to keep that perspective.
Yep, good. So we're going to talk about tariffs and most favored nation stat. No, I'm just kidding. We're not going to talk about any of this.
Got the wrong panel.
We're going to end on a high note. So, we just heard Kristen and Emily talk about the excitement about Texas passing CPRIT. So how do you all think about your hiring plans now that CPRIT's passed? The Moody Center at UTMB, Joe, strong neuroscience, Jim Ray at, So, is this, when the institutions heard that it passed, is there let's get busy on identifying faculty we want to try and recruit?
100%. Even before, we had a strong belief that it will pass because of the strong, support and the need. So even before, we launched Moody Brain Health Institute last year, and really with that in mind, that it could help. It's not just going after the money, But really, I think that resource is going to help us all solve a very hard problem. And us, it's going to focus our effort, and that's really where we are going. So that's the reason to do it, not just the money, but also to solve that problem.
Yeah, agreed. I mean, the money is enabling, but the kind of like the awesome thing about CPRIT has been the talent that it's recruited to Texas across all of your institutions, and I think we can expect the same from DPRIT. All right, well, thanks y'all for spending a few minutes up here doing day 2 of the panel, and if y'all would just give them a warm round of applause for taking some time and being with us tonight. Thanks, y'all. You can.
I guess we're going that way.